Professor Leprince, thanks for joining us. What can you tell us about the future perspective that you're expecting for ECMO and other types of extracorporeal support?
So, as you know, ECMO really became the first line of mechanical circulatory support in many centers all over the world for very sick patients. There are two different plans looking at that. We have very sick patients, like patients with cardiac arrest on resuscitation, on CPR, the crash and burn, what we call the so-called crash and burn patient. Those patients, if you do nothing, they will just die. So the first thing is to really improve the use of ECMO in many centers where ECMO is not available for those patients. We do that in La Pitié, trying to get those patients as fast as we can and implanting ECMO, trying to save those patients. We even do that outside of the hospital. Some even try to do that, even not in the hospital, in the street, in the hotel, and so on. So I think this is going to develop. I don't know how long it's going to take, but this is the future of cardiac arrest. So this is one thing, because more we will get confident in this ECMO system, more the ecosystem will improve also to treat those very specific patients on cardiac arrest. More we will be able to save patients who are particularly with cardiac arrest, which is pretty bad disease all over the world. This is one thing. On the other hand, we have patients who are still in cardiogenic shock, very severe cardiogenic shock, so they can't wait the next day to go to the OR and get implanted with a VAD or whatever, TH. So we implant ECMO in those patients, but more we do improve the way we do it, more we do decrease the rate of adverse events, more we get confident in that. So more we do the implantation early in the course of the disease, and more we can convince centers, medical doctors everywhere that this is a very useful system, which means many patients will be implanted, more and more patients will be implanted with ECMO system all over the world, even if they are not patients with cardiac arrest, because this is what we try to share during this type of meeting you already saw on the previous course. We try to show people this is a very useful system to save the patient, in fact. So this is what the main goal for the next year, for the next years, to really develop ECMO all over the world, so that people will be, it's going to be available for people.
So you're talking about using ECMO not as preventative measure, but not as a last resort.
That's correct. That's correct. We use ECMO for both situations, but again, it is easy to be convinced to use ECMO in cardiac arrest because there is nothing else. You try to resuscitate the patient, the patient stay in cardiac arrest, so you just put in ECMO. In this situation, we really have to improve the technology. To me, the today ECMO technology is not fully developed for this type of situation, because we still need, most of the time, for cardiac arrest to do a cut down of the groin and so on. So we do have to improve that. On the other hand, just by improving the technology, improving the way we use ECMO, we will decrease the rate of adverse events, and we will be more confident in using ECMO in less sick patients.
So I'm sure that these issues are going to form part of the program for the international course on ECMO in 2015. What else can we expect to hear at that event?
During this meeting, we will still try to go further in the knowledge we have in ECMO first, with experts sharing their experience, and now we have some centers with very high level of experience, so they can come and really share this very high level of experience. On the other hand, we still have many centers all over the world who just recently started ECMO program, who just want to start an ECMO program. So those centers, if they come and just listen to very high level topic, this is not going to help them to start the program. So I think we still have to really go back to the basic about indication, about cannulation techniques, about managing ECMO, managing coagulation, managing adverse event, and so on. This is to me one of the priority of the course of 2015, to go back to the basic, to really explain many centers, starting centers, how we should manage an ECMO program. And without forgetting also that in this course we talk about ECMO, but we talk about all the short-term support devices, which are also impeller, tandem heart, all these devices which are quite useful also to take care particularly of acute cardiac failure in the cath lab, in the ICU, and so on. So this is also very important to understand how all these devices can articulate together, either separately or together, because some patient will get an ECMO plus an impeller, or an impeller plus an ECMO, or an intra-aortic balloon pump together. So I think it's very important to talk not only about ECMO, but to speak about all the system we can use in this field.
Mm. So La Pitié is a leading institution in the world in ECMO. How is ECMO practiced at La Pitié, and more largely, how is ECMO practiced in France?
So in La Pitié, where one of the main specificities, the number of implantation. I think last year we did close to 400 patients. Not exactly, I don't know exactly how many, but pretty close to 400 patients, which is a lot, which are more than patients a day. You know, so that's a lot of patients. Many of those patients were implanted in our institution, but many of the patients were implanted outside of the institution with a mobile unit as well. This is the first specificity, is the number, because if you remember when we started in 2002, 2003, we did only, the first year we did only 3 patients, you know. So we had a huge development of this program. Not only because we wanted to develop it, but also because many other centers asked us to develop it, to help them to take care of the patient. One of the other specificity of La Pitié is the organization, which is disorganization. In fact, this is just based on the goodwilling of the people who worked with us in La Pitié, the fellows, the intern, the surgeon, the medical, the intensivist, the anesthesiologist, the nurses, the perfusionist, all, and even the administrative people. You know, all together we try to bring our center to a higher level. And this is true for every surgery we do in our center, but particularly true for the ECMO program. So we got, by doing that, we got a lot of patients, we got a lot of experience, which we tend to put this experience together, to summarize this experience so that we can share this experience to the other, so that they will not do the same mistake we did all over these last 10 years and all over this more than 1,000 patients we did take care of. Recently.
So it sounds like there's a real philosophy of training at La Pitié. What are some of the important techniques that you have in your institution for teaching and training?
So teaching and training is first thing directly in our institution, because very often we have new nurses, new surgeons, new intensivists, and we have to train them how to take care of those patients. So we have maybe every month or every other month, depending on the number of people who come or new people coming, we have in-house training about patient on ECMO. That's one thing. The other thing is because of this experience, we really want to share this experience with others. So we did build up this hands-on course, which is associated to the Paris course on ECMO. International Paris course on ECMO. So during this hands-on, we also try to train other surgeons, other cardiologists, other intensivists, perfusionists, nurses, all these people who take care of the patient with acute heart failure or acute respiratory failure, to train them for ECMO, cannulas implantation, ECMO setup, either VV, either VA, or balloon cannula, looking at the impact of different situations of the patient on ECMO and so on. So during this hands-on, we do that on animals. We also have a basic course for just to to try to, again, to share our experience on cannulation, because there are a lot of things to tell about cannulation, about accident of cannulation, about guided echo-guided cannulation, and so on. And we also have a tour of our facilities in La Pitié, mainly the ICU, the surgical ICU, and the medical ICU, because we have many patients in both ICUs on ECMO. So we have this tour, on one hand, to look at the patient, to look at the indication, and so on, but also, and mainly for the trainees, to look at the organization of these ICUs around the patient, because we really try to keep it simple, because if you make it complicated, it's not going to work anyway. So try to show and share with the others how we get organized with the perfusionists, with the nurses in the ICU. We don't have more nurses for one patient who is on ECMO than another patient, for instance. So this is what we try to do during this hands-on aid, to get theoretical basic, practical on animals, and then practical about organization in the ICU.
Great, thank you.
You're welcome.